As we talked in the introductory video, we talked about there are different modalities that we use in relationship to alternative healthcare. This one is a part of what we do in chiropractic. Now, chiropractic is greatly misunderstood, and we'll talk about specifically about chiropractic in the next video. But what we want to deal with here is people that have disc problems. Now, a lot of times people are told that you don't go to a chiropractor if you have a disc problem. Now, that would be with traditional chiropractic, where you would adjust them and turn them on the side. And that would be dangerous. And quite frankly, I know that. And we're schooled in chiropractic school to recognize the potential damage of a disc. So it's certainly not intended to harm you. Now, this table is called the McManus table. And what it does is you take these straps and put it around the person's ankles, just like this. And what you would do is you can take this table, okay? The table will move. And what you'll notice is you can isolate different areas of the low back or lumbar spine. And because of the ability of it to move and restriction of it, let me say that another way, you can evaluate each one of the areas to determine how well they're moving. You can also evaluate the pathology, really, which is severe muscle spasm, heat, inflammation. And you can actually work on the spine and recognize that if you increase the motion in the area, you increase the blood supply to the area, so you can get some healing to occur. When I first started the practice, patients were told the only way they could actually ever help a disc is to have surgery. Now, fortunately at this time people don't believe that. There's a statistic, if you do have surgery, that the likelihood of you having another one from 7 to 10 years is pretty great. Okay? Now, obviously, it's sometimes necessary to get diagnostic tests. An MRI, based on the examination, may be valuable. But I have seen patients be able to recover from this technique alone. And not only that, but we've had the benefit of having pre and post MRIs, and you actually see that the disc is reduced. So that's pretty much the proof in the pudding. Okay, so this is one part of chiropractic that would be very valuable and would save a lot of people a lot of problems. So we look forward to seeing anyone that's having problems with their disc. Thank you. This gentleman sitting next to me is Harvey. Basically, my first cadaver in chiropractic school was named Harvey, so I decided to name him that. It's a good representation of what the spine looks like. And you'll see there's 24 bones and there's nerves that sit in between the vertebrae. So if you put the vertebra out of place, you can put pressure on the nerve. Now, one of the specific factors of what we do is I do not limit adjusting people in the spine. I adjust their extremities, elbows, shoulders, wrists, hands, feet, elbows, knees. And because it seems to make sense to me that they're movable objects, and if they're damaged in any way or injured in any way, we have a variety of techniques that we can use. neurological, musculoskeletal, that actually give me some indication of what it takes to help to rehabilitate these joints. Thank you.